Hi, my name's Alicia. I'm a student practitioner. Can you tell me your name and date of birth?
Dave Greenwell, November 4th, 1993.
All right, and what would you like me to call you?
Dave.
Okay, and if it's all right, I'm going to go ahead and do a head, eyes, ears, nose, and throat exam on you. To begin, I'm going to wash my hands and start by inspecting his hair. From here, I see that he's got good hygiene. There's no visual infestation. Is there any tender spots on your head?
Mm-hmm.
Okay, I'm going to just take a look here. There's no lesions, deformities, or infestation. Now looking at his head overall, I see that it's symmetric, there's no deformities, no masses, lumps, or swelling, and his head appears normocephalic. So now I'm going to inspect his eyes. From here, I don't see any excessive tearing, swelling. His eyes are symmetric, but to get a closer look, I'm going to have you look down and up and to the sides for me while I hold your lids down. Okay, his sclera is white, his conjunctiva is pink, his cornea is clear, his iris is blue. I don't see any opacities. There was no lid lag or nystagmus. Now I'm going to have you look at my pen light here. Well, looking at his pupils, I see that they are about 3 millimeters in size bilaterally. Now I'm going to have you look at that window in the distance while I shine this light from both sides. Okay. His eyes have a positive direct and indirect response to light. Now I'm going to have you follow my pen light in different directions. I'm going to start back here, go in, and back out. His pupils properly converge and accommodate. Now if you could follow it in different directions. Okay, I saw no lid lag or nystagmus with that. He followed my pen light appropriately. So now I want you to look directly at my light this time. Okay, his corneal light reflex is the same on both sides. So his light reflex is intact. So now I'm going to do the cover and uncover test. I want you to look directly at me and stay looking at me as I put this over your eye, okay? Okay, there's no deviation bilaterally. Next, I want to I'm going to test your visual fields by having you tell me when you see my fingers wiggle. Just pretend like you're in a fishbowl, okay?
No. No. No.
Okay, there was no blind spots bilaterally, so his visual fields are intact. Next, I'm going to begin the ophthalmic exam. I'm going to dim the lights real quick. Okay, just make sure that you can see. Perfect. Okay, so to begin, I'm going to flip this on, figure out my light. I want it to be about 80% brightness. Make sure my diopter is set to 0. If you can look at that window in the distance for me, I'm just going to look at your eye from here, his right eye with my right hand, left hand on your face. All right, I see the red reflex. It is intact. I'm going to now move in forward. Okay, I'm going to adjust my focus so that I can see the optic disc more clearly. I see the optic disc and the physiologic cup. The disc is round. It is yellowish orange with good margins, and the physiologic cup is not bulging, and the disc is not swollen. So next I'm going to continue looking for the retina. Okay. I'm following his vessels. I see the vessels to all 4 quadrants of his eye. The The retina is intact with no lesions. I want to adjust my, oh, and the vessels, the arteries were, lighter and more narrow than the veins, which were thicker and darker. So now I want to visualize more anteriorly, so I'm going to get close again, okay? And I'm going to adjust my diopter to +10. And I want you to look directly at my light this time, okay?
Okay.
Alright, I'm visualizing the fovea and the surrounding macula, both of which are intact with no lesions or bulging or swelling, okay? Now I'm going to do the same on the other eye. We're going to go back to 0. I'm going to go back to 0, and I'm going to have you look again in the distance. Got my... Okay. Alright, so I see his... I see his red reflex, so now I'm going to move in closer. Okay, I'm going to adjust my light so that I can focus on the optic disc here to a more positive number. Okay, I see the disc again is yellowish orange, it's round, it is, it's got strong margins, the cup is surrounding it and it's not bulging. The cup to disc ratio is about 1 to 3 bilaterally. And now I'm going to go back in, I'm going to visualize the Visualize the retina is intact. The vessels, I see the lighter, more narrow arteries and the darker, thicker veins traced to all 4 quadrants of the eye. And then to get a more closer look at the anterior view, I'm adjusting to +10. And I'm going to have you look directly at my light this time, okay?
Okay.
Alright, I see the macula with the surrounding fovea, or the fovea in the center, and it is intact. Okay, so now we're going to move on. Let's see. Flip this back off. We're going to move on to the ears. So from here, I'm inspecting his ears. I see no deformities, lesions. I'm going to palpate your auricles. Let me know if any of this is tender. Okay. Alright, I'm checking behind his ears. I see no masses or lesions. I'm going to switch off my head, put on this, get a large speculum, flip it back on. Alright, I'm going to have you, I'm going to pull his auricle up and back. Okay. Alright, I saw a small amount of cerumen. There was no discharge, swelling, and was there any tenderness with that? Okay. No tenderness or inflammation. I saw his tympanic membrane was pearly gray. I saw the umbo, the handle of the malleus, all of his bony structures were intact. So now we're going to do the same on this side. Pulling his auricle up, back, and away from the head. Okay. Okay. It has died on me again. But if I were to visualize this, from here I see no cerumen, no discharge, swelling, or edema, or redness, and I saw his tympanic membrane and it was pearly gray with, and I saw the umbo and the handle of the malleus, all of his bony structures were intact. Alright, so next I want to move on to the nose. Okay. Switching out this. Okay. So if this was on, I'm going to have you look up. I'm going to put my thumb right here. I'm going to visualize the nose. Okay. All right. And then the other side. Okay. I see that his nasal passage is dark pink with no swelling, ulcerations, or polyps. And his nasal structure from the front is symmetric. Now I want to assess your sinuses, so I'm going to first press up on the frontal. Let me know if any of this is tender. Maxillary and ethmoid. Is any of that tender? Okay. Now I want to look at your mouth. So I'm going to put my gloves on here. I've already washed my hands. Alright, I've got my tongue blade and my gauze. And actually I'm going to flip the light back on. I would have turned that back on for the nose exam. But looking at the mouth from the outside here, I've got my light. I see that his lips are moist pink, intact with no cracking. If you could stick your tongue out. Alright, I'm going to use my tongue blade to kind of move his mouth around here, visualize. Okay, he's got good dentition, all of his teeth are intact. The gums are moist and pink with no ulcerations present. So if you could stick your tongue out again, say ah. I'm going to press down on your tongue. Okay, I saw his uvula rise and fall and it remained midline. Now if you could raise your tongue to the roof of your mouth. Okay, the bottom is intact with no ulcerations. Stick your tongue out one more time for me. I see that the posterior pharynx has no exudate or ulcerations. And I'm actually going to grab your tongue now, okay, so that I can palpate. Okay. Alright, I feel the rigid papilla on the top. On the bottom it's smooth. His gums and buccal mucosa are soft and free of lesions, moist and pink. Okay, so next I'm going to look at your neck. I see that your neck is symmetric. It's got no lesions or deformities or bulging. I'm going to palpate your carotid arteries one at a time. Okay, his carotid pulses are 2+ bilaterally. Now I'm going to listen to them upper and lower. Beginning with lower. And then moving to upper. Okay, there was no bruise upon auscultation. Now I'm going to palpate all of your lymph nodes, and I want you to tell me if any of this is tender, okay? I've got the pre-auricular, post-auricular, occipital, above at the base of his nape of his neck here. I've got the posterior cervical chain. I've got the deep cervical chain, the superficial cervical, got the subtonsillar, submandibular, submental, and then right here we've got the supraclavicular and the infraclavicular. Okay, was any of that tender? Okay, the nodes that I could palpate were soft, movable, and not swollen. Okay, so now I want to look at your thyroid. So I'm going to actually have you swing your legs. I'm going to have you swing your legs to the left here. going to move the camera so that we can see the thyroid. Okay. Okay, so I'm going to stand from behind here. I'm going to place my hands on you, okay? I'm going to bring your cup of water closer. I'm going to place my hands below the cricoid cartilage, feeling for the isthmus. All right, and I'm going to have you take a sip of your water for me, okay? Okay, I felt the isthmus rise and fall. Now to feel the lateral lobes, I'm going to displace the trachea to the side slightly, and I'm going to feel each side while you take one more sip of water each time. Okay, and again. Okay, the thyroid gland is intact. There's no swelling. It is butterfly shaped, and was there any tenderness with that? And there was no tenderness. And that can, oh, actually, we're going to do one more thing. I'm going to palpate I'm going to feel for crepitus at the temporomandibular joint. If you could open and close your mouth for me. Did any of that hurt? Mm-hmm. Okay, there was no pain or crepitus noted.